This is part 2 of our lectures on symptom perception and interpretation from a critical health psychology perspective. In part 1, we discussed how recognizing and interpreting bodily sensations as signs of illness is a process that's deeply embedded in social contexts and negotiated within relationships. In this lecture, we focus on the first aspect, symptom interpretation as socially embedded. Rather than seeing the recognition of symptoms as a purely individual or cognitive activity, we'll explore how cultural and social factors deeply influence this process. To provide a clear framework, let's outline some of the key points that illustrate how our understanding and interpretation of bodily signs and symptoms are shaped by the social context we live in. People interpret bodily signs like pain by drawing on broader understandings of sickness shaped by their cultural background and experiences. An individual's interpretation of symptoms is also influenced by their social identities, such as gender and social class, which intersect and contribute to their perception of illness. There are societal norms and expectations about which bodily changes should prompt medical attention and which are considered normal and not worth worrying about. Cultural norms also dictate how we express illness, when we ask for help, and the appropriate times to seek medical advice. Symptoms are not just isolated signs, but a part of a larger narrative we construct, sometimes without even realizing it, about our health and well-being. Let's examine an example of how these factors affect real-world interpretation. Pain is an example of symptom interpretation as culturally embedded. Pain touches every aspect of being human, whether physical or emotional, chronic or acute. But our experience of pain isn't just about what is happening in our bodies. It's also shaped by the cultures and societies we belong to. To truly understand pain, we need to look beyond the biological mechanisms and consider the socio-cultural, emotional, and cognitive factors that play a role. As one scholar puts it, when we talk about pain, we talk not just about physiological response, but the reaction to pain, its perception, and how people deal with that, and that's highly culturally elaborated. Cultural beliefs significantly influence how we perceive and express pain, which has real implications for healthcare. On the one hand, culture shapes whether we even recognize a sensation as pain. On the other hand, it prescribes how we express that pain, what is considered an acceptable way to show discomfort and to seek help. Before we deal with specific examples, it's important to clarify what we mean by culture. Leading Māori scholar, Sir Mason Dury, describes culture as the shared ways a group understands and communicates, often operating at an unconscious or taken for granted level. While we usually think of culture in terms of ethnicity, it's important to remember that it also encompasses other affiliations like age, social class, and gender. Now, let's explore some examples to see how ethnicity shapes the perception and expression of pain. The examples that I will discuss will illustrate the practical implications of these cultural influences, particularly in healthcare, where a lack of cultural awareness can lead to disparities in pain management, what is often referred to as the pain gap. In Tau Māori, the Māori worldview, pain is not just a physical sensation. It's a holistic experience that interweaves the physical, emotional, spiritual, and social dimensions of a person's life. The Māori model of health, Te Whara Tape Whā, illustrates this connectedness, depicting health as a house with 4 walls: the physical, tinana, spiritual, wairua, mental, hinangaro, and family, whānau. When one wall is weak, the whole structure is compromised. For many Māori, pain is understood as a complex multidimensional experience based on this holistic view of health. It's not uncommon for Māori to perceive their pain as intertwined with their whakapapa, or ancestry, and mana or status. For example, during a study on Māori experiences of pain in cancer patients, participants found it challenging to separate physical pain from emotional and spiritual suffering. One patient said, "There's a lot of pain, but it's not just the inside pain. There's a lot of mamai, hurt, that comes with the rest of it." This perspective reveals how pain in Māori communities is viewed as an all-encompassing experience, where one type of pain doesn't overshadow the others, but rather coexists with a broader, holistic understanding. Māori health workers have expressed concerns that whānau members are often managed primarily with medication, with little attention to their cultural and holistic needs. Many Māori turn to traditional healing practices like rongoa or Māori traditional medicine because these medicines address not just physical symptoms but also spiritual and mental well-being. However, these cultural practices are frequently overlooked in clinical settings, highlighting a pain gap in culturally appropriate care. In Samoan culture, the experience and management of pain are deeply rooted in holistic beliefs that, like for Māori, go beyond mere physical discomfort. Pain is not just a biological phenomenon, it's intertwined with spiritual, emotional, and social dimensions, reflecting a comprehensive worldview. Samoan people often interpret pain in ways that are not limited to physiological explanations. Instead, they see pain as a sign that can have multiple causes, including spiritual or emotional disturbances, which must be understood in the broader context of their lives. One of Samoan society's most prominent cultural values is stoicism, a virtue that encourages enduring pain without complaint or visible display of suffering. This value, known as fa'aloalo, is deeply ingrained and reflects the importance of maintaining dignity and not burdening others. As a result, Samoan individuals might endure significant pain silently, seeing it as a test of character or a necessary part of life rather than something to be openly expressed or treated immediately. Another critical aspect of the Samoan approach to pain is the strength found in connectivity. In Samoan communities, coping with pain often relies on the support of the ainga or family and broader social networks. This collective approach emphasizes the role of community in providing emotional and practical support, reinforcing the idea that pain is a shared experience rather than an individual burden. Traditional practices such as massage or fofo and herbal remedies are commonly used in families to manage pain, reflecting the community's resilience and resourcefulness. However, this cultural approach to pain can create challenges when Samoan people interact with mainstream healthcare systems, which often operate based on Western interpretations of pain and its management. Many Samoan individuals report feeling a disconnect from healthcare providers who may not fully understand or appreciate the holistic and culturally specific ways Samoans interpret and manage pain. This disconnect can lead to a lack of trust and inadequate pain management, as healthcare professionals may misinterpret a patient's stoicism as an absence of pain or as non-compliance with treatment recommendations. So, how does culture play a role in shaping experiences of pain, and why does it matter? Understanding pain as more than just a physical sensation allows us to appreciate the complexity of how people from different cultural backgrounds perceive and express their pain. We'll explore two elements. Firstly, perception. Cultural beliefs can determine whether we even recognize a sensation as painful. What one culture might see as normal discomfort, another might label significant pain. And secondly, expression. Culture also dictates how pain is expressed. Some cultures encourage stoicism, like the Samoans that we discussed above, while others are more expressive and open about suffering. These cultural influences have important implications in healthcare settings. If healthcare providers aren't aware of cultural differences in pain perception and expression, they may misinterpret symptoms, leading to disparities in pain management. This raises a critical question. Does ignorance of others' culture influence our clinical attitudes and the assessment and treatment of patients? By looking at these examples, we can begin to explore more holistic and culturally appropriate ways to assess and treat pain. Culturally responsive pain management is crucial but often lacking in the healthcare system in Aotearoa, New Zealand. To address this, healthcare providers must broaden their understanding of pain management to include Māori perspectives. This means recognizing that pain is not just a physical ailment, but an experience deeply rooted in cultural and spiritual contexts. By incorporating these perspectives, the healthcare system can better support Māori patients, leading to more equitable health outcomes. To improve healthcare outcomes for Samoan patients, clinicians must build a stronger relationship with Samoan individuals and their ainga. This involves nurturing the wā, the space and connection between people, a fundamental concept in Samoan culture. Understanding these cultural nuances is vital to addressing the healthcare needs of the Samoan community and ensuring that pain is managed in a way that respects their values and beliefs. These are but two examples. By fostering these relationships and appreciating the broader psychosocial aspects of pain, including its spiritual aspects, healthcare providers can offer more culturally responsive and effective pain management. Recall that Dury's definition of culture includes other social categorizations like gender and social class. And indeed, other norms associated with these social categories significantly influence how pain is experienced and expressed. For example, Western and many other cultures, gender norms often dictate that men should be tough, which affects pain sensitivity and reporting. Research shows that men typically have a higher pain threshold and tolerance, but this might be due to reporting bias. Men often avoid admitting pain until it's severe. Social norms may lead men to feel pressured to suppress their emotions, including pain, which can impact their health. For instance, men might avoid seeking help for conditions like prostatitis, a prostate-related condition that can include pain. Embarrassment around these symptoms of pain may prevent men from seeking help. In working-class communities, pain is often normalized as an unavoidable part of daily life, particularly for women. Conditions like period pain or childbirth may be dismissed as routine or trivial, reflecting broader socioeconomic patterns where healthcare is less accessible and medical concerns are frequently downplayed. This normalization can lead to underreporting of pain and delays in seeking necessary medical attention, perpetuating a cycle where pain is viewed as a minor inconvenience rather than a serious health issue. Pain affects all of our lives. It's essential to know about how we all experience pain and the different types of pain we have to ensure no one's pain is trivialized, ignored, or left to stereotypical preconceptions to define. It's clear that understanding pain and other bodily signs is deeply intertwined with our cultural backgrounds. As we've seen, how we respond to symptoms like pain is shaped by our cultural knowledge, which is influenced by our ethnicity, gender, and social class. These cultural expectations dictate which symptoms are considered normal and which require medical attention, affecting how and when we seek help. Reflecting on our initial question, why do some people rush to the doctor at the first sign of a headache or pain, while others wait until pain becomes unbearable? We see that our responses to bodily signals are not just personal choices, but are also molded by cultural frameworks. By acknowledging and addressing these cultural influences, we can improve our recognition and response to bodily changes, ensuring that everyone's pain is taken seriously and appropriately managed. Ultimately, understanding these cultural dimensions isn't just an academic exercise, it has real-world implications for health and well-being. By appreciating and respecting diverse experiences of symptoms, we can work towards a more inclusive and effective approach to healthcare. Every symptom tells a story,
And by listening closely, we can better support each individual's journey toward wellness.